Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California 94568. Phone number 408 687 1899. Anytime, if you are suffering from any disease at any age and you are not getting well, you can call me for your second opinion of the disease as well as of the treatments. Why any treatment is not working properly, why it's not improving. I can give you the clues as per the nature's record, how the nature was curing our diseases when we were sick before the medical science was not there. Existence of medical science is a far later after that. Previously, it was just a hit and trial methods, or it was only dependency of on the natures. Nature dependency was far better as compared to the today's medicine, because most of the diseases are man-made. There were not too much diseases before this existence of the medical science, but as we have added our own knowledge into it, and moreover, we are trying to make everything fast as we can. Nature has its own course, its own time to recover the things, to run the life on the earth. And if ever it falls sick, how to recover it? Nature has its own principle. But with the knowledge, with the advancement of this life, society, civilizations, demand of the time, we are bound to make it fast. It has become a necessity at that time that we want to be cured immediately as far as possible. And that is why we are doing other alternatives. We are adopting some types of ways which basically does not suit to the nature, does not suit to the functioning of our body. It means we force our body to work against the normal natural rule, how it was recovering itself. Because at this time, we know that every tissue of the body has its repair time. If ever anybody falls sick, they recovers in a due course, and that due course indicates depending upon the cells which are damaged inside the body, and every cell has its recovery period. Many times in these lectures I have described that the epithelial cells are damaged and they are supposed to be recovered within 3 to 7 days. If bone tissues are damaged, it takes about 6 weeks to be repaired. So this is a natural way. We have learned from the nature that nature itself recovers all these things. Different four kinds of tissues we have in our knowledge. We know that, and all the four tissues we have their specific time to repair. It also depends upon the environmental conditions. It also depends upon the food we eat. It also depends upon the environmentals. So, in this way, what happens? Everything has been adulterated. And also, not only the environment, but our medications, our mentality to recover as fast as it could be has adulterated the system of treatments, has adulterated the route of disease to go off, means recovery. So, in this way, with our knowledge, extreme knowledge, we have complicated it. We have adulterated it, the natural phenomena. Moreover, even suppose if we do not do that, we must understand this thing that the recovery of the body is itself. If I say medicines do not recover diseases, it looks very hard, rash, and foolishness to say that the medicines are not recovering. Basically, the recovery of this body is has is its own internal, according to its own principles. But what we do with the medications? We do with the medications that we protect another adulterations. We protect the adulteration of this process by any other ways outsider, and it is recovered. Just like if we have to repair a mud wall, and we put mud on that from outside and we repair it. But the recovery of our body is not like that. Yes, we can manage it, just like bones broken. And you can bring these broken bones together and make it fixed over there by plasters. That's a management. Yes, you can do management for that one. But you cannot fast the recovery of the cells. Yes, if we know that a particular type of cells are damaged in the sickness or in the injury or anyway, and they will take this much time to repair. And ultimately, if they are not repaired in due course, in a normal procedure as it should be, it means something is wrong in the natural go of life, natural procedures, and that is why it is causing some problem in the route of recovery. And then we should find it out. It's automatical. We should find it out that what are those hurdles, what are those causes, what are those problems by which this recovery has been stopped or delayed. So in this way, the medicines what we give, internally or externally or whatever, the purpose of these medicines is to protect from hurdles, to protect from injurious environment, injurious substances, and all that, which may cause delay in the process of recovery. Otherwise, medicines do not medicines do not you can say initiate or make it fast the process of the recovery. If all the other tissues are cooperative, if all the other tissues are okay, if from any side of the body any other infection is not coming or any adulteration is not coming to the site of injury, automatically it will repair. I can just give you one example. If you have a cut on a tree, if you have a cut on a tree, it automatically recovers. It recovers automatically. No, even nowadays, botanists, they are doing some different kind of experiments like human beings to the trees as well. They are doing it to make it easy, fast. But because of the adulterated environment, sometimes the natural recovery of the tree is also delayed. They do not recover in due times. You cut the tree, the recovery takes sometimes longer period, but it has already been learned that how much time it will take to recover the injury of any tree. The same way, our body, it has a specific time for each and every tissue that it will, if it is damaged, if it is cut, it will take this much time. I'm saying cut. Cut means bone is broken, tissues are broken. Management is to bring them together so that a normal process of recovery can start easily and fast. Yes, you can make it fast. Otherwise, if tissues are cut and there is a gap, to fill up that gap by the internal processes may take long time. Whereas we can make it fast, that's understandable. We stitch the wounds so that all the cut ends, both cut ends comes together, and ultimately the natural process takes easy way to recover. But if the cut wounds are not repaired in this way, previously there was no stitching, no surgery, nothing else. We do not know about that one. Even then, the wounds were recovering with some deformities because it was not coming in the normal, natural way after recovery. Sometimes you may see broken bones, they are having wound in that, they are having a gap in that, and all that, but they are repaired. The outwardly wound is repaired. Outwardly, wound is repaired, no doubt. It is not having direct connection, just like the skin is protecting the internal connection of the outer environment to the internal organs. In the same way, that wound has been recovered. So, from that source, the external environmental cannot interfere in the internal system of our body. That is protected. But the gap, if you do not facilitate by means of surgery, you can say, by means of surgical helps, interventions, it may take longer time to repair, and even it is possible that it may not be according to the nature's setup, how the nature has set up that part of the body. It may not be in the same way. A gap may be visible for a longer period, even up to end of the life. That gap shows that when there was wound, it was not given external help by the surgery to bring both ends together so that this gap be filled up. Gap is filled up, but this gap shows deep wound inside, and that is repaired. So in this way, what you can say, that as far as we are civilized, our medical science has advanced. It is trying to recover everything, disease, rupture, repair, broken, everything according to its own process. And told you that for the outwardly cut wound, all these things, to help them bring together by means of surgery is okay. But if you say we can uh, initiate fast recovery, no, it's not. Yes, this is fast recovery, that you bring the cut end together. But ultimately, the repair process has its own course that will follow. Then you can say, well, what's the purpose of the medicine? This is what I told you in the beginning, that medicines are not helping in this way that they can do the fast recovery. Fast recovery is that they are protecting outside infections. They are protecting another adulteration of the wound. Wound has occurred due to internal damages. Wound has occurred due to external injuries. Whatever is happened, that is because of some type of injury, internal or external, that you can protect this body, that these wound or these cut portions or these adulterated things or these damaged things should not be adulterated by other bacteria, by other outwardly infections at that time, and this medicine is working for that one. That is why they are not directly uh, having any, you can say, effect on the normal recovery of the tissues. Normal recovery of the tissue depends upon the tissue damage. What type of tissue has been damaged, that will take its own course and that will take its own time to repair. But the time period may be longer if it is adulterated. adulterated by food, adulterated by environment, adulterated by other bacteria and everything. In whatever way it is adulterated, it may take a longer period. So, yes, the medicine helps us to save it from another adulteration, from other damages which may cause the external damages. Suppose if there is the appearance of the bacteria and all that, and after there was a wound, after there is any disease, because bacteria are also going inside. In this way, if the internal or external damages of this body, to which we call disease, has been adulterated with another bacteria or another type of infection, just like pus formation, pus forming bacteria and all that, or different kind of bacteria, then the disease may linger on. And what we are doing, we are helping by our medications, we are helping the system to protect it from the other type of adulterating products which can adult adulterate the system, and system is not recovering in time. So this is the purpose of basically the medicine which we are giving, and but it cannot accelerate. Basically, we explain it as acceleration. We are accelerating the cure, but it is not. It is not. We are just protecting it, and the nature takes its own course to repair the wound, to repair the disease, to recover the disease, and everything whatever has gone wrong with the disease inside the system, nature has its own course, body has its own recovery, and that is internal repair of the tissues. So that is why in the initial stage, in the first stage, when we are start talking, that the medications we are applying do not cure the disease, because they cannot change the process of repair of nature. The nature has set up already how the epithelial tissue cells will be repaired, how the bone tissues will be repaired, how the nerve tissue will be repaired. Every type of tissue, nature has its own setup, and they take its own course in a normal way. Normal way means if they are not adulterated, but if they are adulterated, then it may take a longer period. But the medications give us indication, oh, there is a pus formation, oh, there are different kind of bacteria, and then we find out some other type of medications which can kill those type of bacteria, which can kill that type of infections and pus and all that. Yes, that is the helping type of things. That is the helping type of things, and we do that. Yes, it was going deteriorate. Ultimately, it may become worse. And then nowadays we have to cancer, autoimmune diseases, and various other names, dreadful names we have, because we have adulterated the things, or we are unable to protect it, protect the body's condition, disease conditions from the other adulterations. From other adulterations, we are unable, we are not having knowledge about that one, that this body is going to be adulterated by some other things. That's why new names are every day coming to our knowledge. New name of the diseases are coming to our knowledge, that we are unable to find it out what are the causes which are adulterating the way of cure. That is why cure is not taking place normally. It is taking long times. But normally, our purpose, the purpose of the doctor or the medical science, is to protect it from the adulteration. That's all. So now, come to the new chapter. Our regular lecture, we are giving this the life, how this life was progressing since beginning, since the sperm and ovum joins each other, and after that how it was developing, and the mother's verbs and all that we have already described. And now we are at the stage that we are describing the different section or different parts of this body, that in what are the organs in what particular part of the body, and if they are damaged, what type of signs outwardly we can see. I'm ignoring the medical science at the time. Whatever our achievements are, ultrasounds, scans, MRI, whatever the test or lab test and everything, I'm just giving you the briefing of that area, that actually if anything happens and we do not have, and all the, because these facilities are in the civilized area, these facilities are in the cities, in the hospitals, and before you go to the hospitals there are still some chances that if you can understand that what is the disease, what it may cause, what are the indications of the disease, that what organ has been damaged inside the body, and this is indicated outwardly on our body, on our outwardly expression of the disease, you can say it, that we must learn that if there be any problem inside the head, just like we described previously, inside the head, we know that there are some organs, cerebrum, cerebellum, mons, medulla oblongata, pituitary gland, hypothalamus gland, pineal gland, many glands, many things are there, and nervous system, all that, up to the foramen magnum when it joins with the vertebral column. So we know about those things. But if anything goes wrong, means if any internal organ is damaged, and it indicates outwardly. Last time I give you the example that sometimes uh, suppose if you throw a stone in a pound of water, you see there are circles and circles and circles. They are dilating, making bigger and bigger circles. And ultimately, at some point, we cannot see that. Where we put the stone, we see the bigger circles. Visible circles, you can say, not visible, bigger, but visible circles. Ultimately, as time passes, the circle becomes larger, circle becomes larger, and ultimately it reaches to the other bend, other corner of the pond. We can, even it may be miles, it may be whatever it longs, but if we have any device which can detect even the minor vibration inside the water, because there is no breakage, water is complete, there is no any section, you can say there is no water, no, everywhere there is a water from end to end. So it means if you put anything extra in that, the same way it has changed up to the end, and those circles outwardly we can see only up to our vision. As far as our vision is, we can see those circles, but after that we cannot see. But it does not mean that if we cannot see, there are no circles. No, that changes into the, because that stone has separated the water from at that point, but water is equally. In this way we can see the this sensation or this feeling at the bank of the pond on the other side. In this way, with this example, I want to just convey this one. Our telephone lines, our environment is a compact, there is no gap. Everywhere in this universe, our environment has oxygen. On Earth has oxygen. Not only the oxygen, there are many more gases in the environments. And ultimately, there is no gap in between that. We dial a number on the phone, and immediately one of our relative, India, they pick up the phone. It rings over there. In a moment, in a fraction of a second, it rings over there. It means there is no gap in between that. These two examples I'm adding just to convey you the idea that this body itself, the life force itself, has no gap. Anything happens on my fingers, my whole personality, my whole life force feels that one. We feel feverish. This is small pimples, small tumors on my finger, and it's paining, it's inflammations, and we feel feverish, we feel tired, we feel pain, and that pain is felt by the whole body, though it is there. In this way, I want to convey you this body itself has a compact system, compact, you can say its own total structure. There is no gap in that one. And if anything happens in this body, in any part of the body, does not mean that it is only affecting that portion of the body where it has hit. No, it has changed the total environment of the body. But we feel it more where it has hit more. And we are identifying nowadays that if in different organs of the body a disease is invaded, a disease hits. Second thing, I would like to convey you one thing: life force, which is responsible for the functioning normal or abnormal of this body, that is invisible. When we die, our all organs remains here. They do not see, they do not taste, do not work, do not smell, nothing. And even the weight remains the same. What has gone out? That's power. And that power is known as vital force, and that power is responsible for all the normal or abnormal function done by this body. Same way, if any other influence, just like the influence of mosquito, you know malaria, it's a malaria. You just know about that one because you have named it. You have named some type of symptoms. It's a malaria. You named some type of symptoms. It's a cholera. You name some type of symptoms. It's a diphtheria, tuberculosis, whatever. You name some of the group of the symptoms which this system shows, and the system shows as the vital force is perceiving those things, is observing those things, and expressing herself or himself by some particular type of organ. Yeah, mosquito is cutting on our hand, but fever is the whole body. It's not the mosquito, it's the influence of that toxin which was invisible. Influence of his cut by mosquito, punch of his mosquito, and the influence which has affected the environment of our vital force, and how it has affected, just like the pound stones you put in that one, in this way, that is felt in the whole personality of the person's whole body. Every tissue feels it. But where this stone was thrown, we can see visibly over there. The same way, we can see some of the symptoms in this personality, but most of the symptoms are generalized. Fever is generalized, shivering is generalized. If there be vomiting or anything else, that is generalized. So in this way, every organ, if it is affected by outwardly influence, not the material thing, not the bacteria, not anything else. No, their influence, every outwardly impression, even the air, even the bacteria, even anything, even the food, whatever, they have their influence, how they change the environment of our body. And that is perceived by our vital force. And vital force itself express her concern by a particular type of symptoms, and now we are recognizing those type of symptoms that they are indicative of what type of damage inside the body. Just like I told you about the head, if there be anything happens in the head area, dizziness, ecchymosis, numbness, all these things, many symptoms we have described, and that which are the preliminary symptoms. If any organ, by whatever way, by injury, by infection, by anything else, internally or externally, when anything has happened to the brain area, it is indicated outwardly that there is a dizziness, forgetfulness, sleeplessness, all these things are happening, and they are indicative of that something is wrong inside the brain. And if ever we cannot take care of that at home, we can take the patient to the appropriate department so that they can take it up immediately, and they can provide help immediately, advice what to do immediately without wasting a time. In this way, after that, after the head, we have talked about the neck. There are many more structures because the head has connection with the whole body through the neck. All these structures, vasculars, nerves, bones, whatever, from head it is connecting to the body downward. So it means everything is passing from the neck. So we have described about that one, that in the neck, these are the organs. We started from the vertebral column, we started from the pharynx, we started for the larynx, we started epiglottis, we started bronchus, we talked about trachea and all that. All these organs we talked about, that these are the organs, and if ever anything happened to the neck, what are the signs outwardly we can see? So, in our previous lectures, we have discussed about this one, that if anything happens from outside or from inside or in whatever way to the neck area, it will represent some type of signs outwardly, so that from seeing outwardly signs, we can assume, we can diagnose, we can come to know that in the neck area, this is the problem, so that we can help the patient in a proper way, what we can do for him to facilitate him, or we can transfer him to the doctors or hospitals to the appropriate type of department. The same way, after that, we are entering into the chest area, because all other bones, structures, formation of this body we have already discussed. But now I'm just telling you that a particular area of the body, if is damaged internally or externally, and is expressed by some symptoms which are visible outwardly, signs and symptoms both. So we are talking about, we are reaching to the area of the chest at this time. If first of all, before knowing what are the signs and symptoms of that one and what it will indicate, first of all we must know in chest area what are the organs, what are the viscera, blood vessels and everything, so that we must know that outwardly sign is the indication of internally what organ is damaged. So just I'm going to describe this thing, please. This is very important lecture for you. This is very thing. The main, you can say the department who is running, head office who is running this body. It's it's covered inside the chest, heart, lungs. These are, and the connection from the brain to other body parts. This is the main important area. Suppose if hip area is not there, we can make any alternative. We can make any alternative to the discharge of any wastage. We can make that one, and ultimately work whatever is done in the pelvic area, that is genetic. So genetic type of things, if we do not do that, even then we can survive that. Urinary passes we can make from outwardly. Stool passes we can make outwardly, something like. And if we do not do that, generations, it's okay. It's not for all the persons, only one or two or any individual persons. But the chest area is that important area in our body that if any of the part is damaged, is influenced by disease, is suffering from any problem, will be indicated outwardly, and we must know that. It's very important. We must know that what it indicates, what are the signs and symptoms, and what it indicates. Now, before going to this chapter, we must know what are the organs in this chest. First of all, I will start with the chest. Backside, everybody knows about the vertebral column. Everybody knows about the thoracic vertebrae. These are 12 in numbers. Structure of the vertebrae and all that we have already described. That just listen, that this is the bony part. You can say it is the bony part. Then after that, there are the components, you can say, inside the body, and those components are divided. Cage type vertebral column is backside. Cage type, completing the case, ribs are there, 12 pairs of cranial, 12 pairs of this ribs are there, and 12 pairs we have already described you that 7 ribs are united back and front both ways with the sternum and with the vertebral column. 3 ribs are not attached directly to the sternum, but they are attached to the different ribs and going back and making a wider opening for the abdomen. And the 2 ribs, we told you that these are open from the front, and the abdomen becomes enlarged. The abdomen can have big space to enlarge if ever it is desired, just like in pregnancy, just like in gas and all that, so that if needed, it can enlarge. And the ribs, false ribs, are known as, they can facilitate it for the enlargement of the abdomen. And so, sternum, we described about that one, all the 3 pieces of the sternum, and upper piece is known as manubrium sterni. On both sides of the manubrium sterni, there are clavicle bones which are uniting on the other side with the shoulders. And then the body of this sternum is united with manubrium sterni from the downside, underside. Then body of the sternum, and it has another portion that is known as the lower portion, that is the xiphoid sternum. So manubrium sterni, body of the sternum, and xiphoid process, these are 3 parts of the sternum in front and 12 vertebrae in the back sides. Bony part. Upper part, there is a clavicle bone. So this is what I told you, and their joints, all that. This is the outwardly structures. After that, I discussed with you that there is a 2 gap, or you can say the 2 envelopes which are known as pleural cavities. Right pleural cavity and left pleural cavity. Right pleural cavity has right lung. Left pleural cavity has left lung plus the heart. The heart is adjoining to this cavity on the left side. And also, the heart is also covered by another covering of similar type of that one, that is known as pericardium. And they fill the whole main area on both side of the chest inside the chest, right side and left side is filled with the lungs and also the heart. More portion of the heart is on the left side, but a little portion I describe you about that one. If we want to measure it from outside, from the mid sternum line, this is sternum bone. From the middle of this bone, if you measure 1.2 centimeter on the right side, this is the border of the heart. It means heart is basically covering more of the left side, some of the middle side, and a little of the right side of the chest. And it has its own envelope that is known as the pericardium. After that, there was a main structure that is given name mediastinum, means middle. In the middle of these two envelopes, pleural cavities, which involves the lungs, covers the lungs, there is a middle area. And that middle area is known as mediastinum. And that mediastinum uh, is the middle portion, and it is having very important structure passing through compound pathway. Very important structures are passing through the mediastinum from head downward to the chest and also to the abdomen and downward. Just like from upward, many things, just like the carotid arteries, are going upward, and the carotid veins going downward, taking blood. Carotid arteries are taking blood to the head through the carotid arteries. Carotid veins are taking blood back to the heart with the carotid veins. They are passing from that one. In the vertebral column, you know that there is a canal, vertebral canal, which has a bundle of main nerves issued from the different parts of the brain, and they are controlling the whole body up to the fist, up to the end of the feet. That's known as the hallucis. Up to the hallucis, it covers everything, every tissue, every cell of the body is controlled by these nerves which are passing through the vertebral column. And the same way at the thoracic area, these nerves are controlling all the organs inside the chest. And we are talking about the muscular things: heart, lungs, we have covered. These are the main organs. But we are now talking about the main pathway from head to downward, and that is known as the mediastinum. And through the mediastinum, other structures, other the blood vessels or everything, the main blood vessel is issued from the left side of the heart, the lower portion of the heart, that is left ventricle, and goes upward in front of this manubrium sterni. It turns backside. It turns at the level of about second rib. It turns backside along with the vertebral column. It goes downside, downward to supply the whole body the blood circulation, and that is known as aorta. That aorta is also a part of this mediastinum. And through this mediastinum, thoracic descending aorta is passing down. Thoracic abdominal aorta downward, its name is changed. The same same, you can say the structure or same blood vessel is passing through the mediastinum. This is the common pathway in the chest. After that, there is a another structure, that is the food pipe. Our food pipe starts from the mouth, goes backward. The first portion is known as pharynx, mouth. Afterward, there is a downward portion that is known as pharynx, and it goes up to an area that is known as epiglottis. Why that's important? Epiglottis is an area because another structure comes here, that is respiratory area, our windpipe, you can say. From the nose downward in the backside, the portion is known as larynx, which passes the air from nose to downward, and it also reaches up to the epiglottis. And at the epiglottis, what happens? The larynx is coming from the backside. Food pipe pharynx is coming in the front side. But when they come here, they change their pathway. They change their route. The larynx, the respiratory organ, comes forward, and the food pipe goes backside. There is a special type of valve situated over here, which works automatically, and depending upon the nerves over there, they control the function of those things. And when you breathe, because you breathe continuously, when you breathe in, when you breathe out, inspiration and expirations, this pathway is open to go to the lungs from the epiglottis. And when you eat and swallow, when you swallow means when it goes downwards, then the pathway of the food pipe further from the epiglottis is opened, and it shut down the area of larynx. The same thing, one time when I was describing about the genital organs of the male, I told you about that one. The same thing happens in the testis, that urinary in the prostate, outside of the prostate, outside, downward in the bladder, there is a prostate. Prostate gland is pierced by is passing through, pierced by the vas deferens, and that vas deferens is carrying the sperms from the testis. And every time you pee many times in the day, that pathway is open. You can go whenever you desire to pee, you go and you avoid urine. But your erection, your discharge, ejaculation is a limited period, limited times. In this way, when you ejaculate, that type of platform is open. That kind of kanta is changed, and a track is changed, you can say. Just like the railway track, that is changed, and that goes outside. In this way, this epiglottis area is a that kind of valve, is a that kind of structure which is closed, shut down, closed, shut down, depending on the demand, whether you want to swallow the food, whether you want to pass the air up and down, in or out, whatever. So, according to the demand, this epiglottis area is a junction and is a valve there which allows according to the need, so that food can go to the food pipe, air can go to the lungs into that one. But sometimes you might have heard from the peoples they are choking. Choking is concerned with this organ. When this valve is paralyzed, you can say, and is not competent, is not working according to the demand, at that time sudden, sometimes the food particles may go towards the bronchus. In this way, there's a big complications, big complications at that time, and sometimes people may die with that one if that particle has not been coughed up outwardly. Now there is a surgery and everything, many things are done, and nowadays, but even then, it was a serious thing at that time. If the food particles goes towards the larynx, with the bronchus, the lower portion of the larynx, when it issues after the trachea, it is known as bronchus, right bronchus and left bronchus. These are two bronchuses, right and left bronchuses. And food pipe, when passes from this tracheal area, epiglottis area, you can say, that is known as esophagus. And this whole everything is covered by a trachea. So epiglottis is covered by, is protected by a cartilaginous structure that is known as trachea, because it's an important thing. It should not be hurt now and then. To protect it from the external injury, yes, internal, I told you the choking, but external to save it from the external injury, the nature has fixed over it a type of cartilaginous structure, a spring type of structure that is known as trachea. And this trachea protect the epiglottis area of food pipe, of respiratory larynx type, and downward their names are changed. The larynx becomes bronchus, and the food pipe pharynx name is changed, it becomes esophagus. So these things are changed from that very point, and ultimately they go to the specific, just like the bronchus goes right to left to the lungs, and the food pipe goes to the esophagus, and downward it passes from the chest area, that is also a muscular type of membrane type of things, that is known as diaphragm. Its other name is also phrenic. And this is a partition between the thorax and the chest. It's a membranous type of, you can say, structure. Means it's flexible. It's not like bone that it cannot flex it. It is strict. No, it is flexible. If there be any congestion inside the chest, it may descend down. If there be any congestion in the abdomen or gas formation, distended abdomen, it pushes the chest organs upward. Up to a limited area, it's okay. But just like a lady is pregnant, and during the last weeks of the pregnancy or last month of the pregnancy, abdomen is enlarged too much, it pushes the diaphragm upward, and sometimes the ladies are having hurried breathing, ladies are having fast breathing, ladies are having more number of breathing, just like we normally say 14 to 16 times per month there is a breathing time. And but during these conditions, when there is the distended abdomen, and particularly during the pregnancy, everybody can see that it is more time, more than normal. So that indicates that the area has been covered by something else, and it is pushing up the chest areas. And chest area has to expand to take more oxygen, whatever it desired, but it has limited area. So then it goes time and again, more than time and again, so that they can fill up the demand of the oxygen to the blood, so that it can go back. And the same way, heart has to pump more. Heart has it has to beat more, more time. So everything changes with this one. So this is the diaphragmatic area, diaphragm, which has a separation from abdomen to the chest, which is not visible outwardly, but it is a complete separation between the thorax and the abdomen. And there are separate, different 7 openings, just like the esophagus I told you. It passes from that one and goes to up to the stomach to join with the stomachs. And the same way, blood vessels, the main blood vessels, just like aorta, I told you, thoracic, descending thoracic aorta is passing from this diaphragmatic structure, goes to the downward to supply the abdomen, and also the vena cava, which is bringing blood back from the feet to upward. That also is a big trunk which is also passing downward to upward to go to the heart. In this way, different kind of other structure, nerves also passing from here. Okay, so in this way, many type of structures are passing. Mainly, there are 7 big things which are passing from diaphragm downward, and also from downward to upward, so that their connection be maintained in between the thorax. And first of all, there is a connection in between the head and thorax through the neck, and those connections are going more fast from the head to the abdomen as well. So in this way, this thing is a pathway which is known as mediastinum. So mediastinum is a main structure also, and having the main important structures enclosing in it, and they are safe. In front is a sternum, back type is a vertebral column, and on the sides there are lungs. So that these structures pathway protected from all other injuries, easily it is not hurted. But internally, it with the gas formation, with the heart is heartburn or all that, it may be affected. It may affect even the adjoining areas when they pass from the stomach to upward and all that. That we will discuss later. What are the signs and symptoms? So we have just given you the information, skeleton type of things, means the structure, how the chest is formed by the bones, backside and in front side, and the bones, sternum and ribs, and the thoracic vertebrae and all that. And after that, we have described about the muscles, just like a muscular structure. That's the diaphragm I told you about. And also the one more thing before I go, there are some muscles which are binding the chest in front. That is pectoralis major, pectoralis minor, subscapularis, serratus anterior. These are the 4 muscles which are making, protecting the ribs before the ribs are broken and something like that. This load is taken up by these muscles, and they form the structure. And on the back side, in the backside, there is a scapula, both side, both where the shoulder blade you call. Backside, there are 2 shoulder blades, right side scapula, left side scapula, and there are 2 muscles from the scapulas issued. Those are known as supraspinatus and infraspinatus, because on the back side of the scapula, there is a spine. There is a spine, and it divides the back side of the scapula into 2 portions, and one is upward, the other is downward. So that's why the same way the name is given, which muscles are coming from that one, supraspinatus and infraspinatus. From down area, infraspinatus; from upper area, supraspinatus. These 2 muscles on right side and these 2 muscles on left side, they are binding the scapula over there. And there is a trapezius muscle which also binds the back side with the chest. So these are the muscles, and they are normally taking part in the formation of the chest. These are the structures. When they are hurt, they show their symptoms. We will discuss later on. And after that, there is a intercostal muscles. Intercostal muscle between the ribs, so that the ribs be fixed in an equal distance to each other. Their distance should be fixed by the intercostal muscles, so that this whole structure is formed in a systematic way, in a fixed difference from each other. So these intercostal muscles are also working over there. So even intercostal muscles may be hurt. Intercostal muscle may have some changes, and in the costal cartilages, which makes the joints with the sternum, intercostal cartilage, which make the joints with the vertebral column. These are also the structures of the chest, outwardly and inwardly. We have described all these structures which are here, and definitely the vessels we have described, the nerves we have described, major blood vessels we have described, lymphatic. One more thing I can tell you: the garbage, wherever there is a artery, there is a vein. Means going and coming back. Blood is going by the artery from the heart to the other systems, and coming back, that's vein. Uh, Artery and veins goes parallel with each other, and after that, the third structure, wherever there is a vein, there is a lymph channel. Lymph channels to filter the extra garbage which is coming from the tissues, so that it should not stop the flow of the backward flow of the blood going to the heart. That's why nature has set up a fixed type of another channel that is known as lymph channels, and that collect the garbage from the blood vessels, veins especially. And ultimately, when there are three structures, artery, vein, and lymph, there is another fourth sector to take care of all these things, to send their information, their problems to the brain, and getting order from the brain. That's the nerve. So nerves are also passing from that one. So I described about the blood vessels, I described by the nerves, I described by the lymphatic systems, and phrenic vagus nerves and all that. These are passing, these are the part of the nerves which are passing from the chest. So ultimately, we have described you all the parts which are taking part to form the chest and working inside. And if ever any of the part is damaged, I will discuss one by one. If ever any of the part is damaged, has any problems, what type of outwardly signs we can see, we will discuss in the other lectures. Now time is over. This is Gurdeep Singh Sandhu, your homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568. Phone number 408 687 1899. Anytime, if you are suffering from any disease at any time and you are not getting well, you want to ask the questions regarding your disease and regarding your diagnosis and regarding your prognosis. Or if you say that my condition is a standstill and not improving with the treatments, you can call me to get your second opinion of the disease. And also, if you want to get treated by a scientific homeopathic approach, you can call me 408 687 1899. And also, the last request every time we do that, if ever you think these lectures are beneficial for you, please convey this message to your nearest and dearest persons, so that they can also listen. They can join a YouTube channel, they can join me in Facebook channel, and also they can download the app of that Sabrang radio station, which is every day joining with us. And from 5 to 6 on that radio, this lecture is delivered. There are other different programs, 24-hour programs on Sabrang radio station for the entertainment all over the world. Wherever you are, you can listen it everywhere. And you can listen all the entertainment programs. You can listen Gurbani, you can listen Nitnem, Rehras, everything on this radio stations. And from 5 to 6 every day, California Pacific Standard Time, you can listen me for this health education lecture series. And I'm delivering these lectures since 30 years here in America. So God bless you all. We'll see you tomorrow, and tomorrow will be Hindi lecture for all these things, so that everybody, whosoever is understanding Hindi, Angrezi, English, whatever, all the three languages, persons should understand how this body is formed, what are the organs inside the body, how they work normally, If they fall sick, what are the outward indications we can understand easily before going to the doctor? That's what problem he is having and what organ is defected. God bless you all. We'll see you tomorrow. Sat Sri Akal, Adab, Namaskar.